Hi everyone, I'm Gunjit Glenn. I will be presenting on evaluating the association between gestational diabetes mellitus and anemia in pregnancy. To introduce the topic, GDM is prevalent in around 14% of pregnant women all over the world, and maternal iron stores evaluated with ferritin and serum iron levels have been shown before to have to be associated with an increased risk of developing GDM. But the research on the CME is quite sparse right now, and in India we don't have a lot of studies. Our primary objective was to estimate the effect of hemoglobin levels on the risk of developing GDM in pregnant women, and our secondary objective was to describe the impact that gestational weight gain, represented by BMI gained over pregnancy, on the association between this hemoglobin levels and GDM risk. The rationale is that iron markers, since they have been seen to be positively associated with both diabetes in a normal population, non-pregnant population, and GDM as well in pregnant populations. And anemia is a very highly prevalent condition in India, with iron supplementation basically being a reflex prescription for pregnant women. Is iatrogenic GDM something we can consider out there in the population, especially for groups that are highly susceptible for getting GDM. Also globally, there's an inverse trend in incidence of GDM and anemia that has been noticed. The methods are, it was a case control study with a sample size of 226 participants, 75 cases and 151 controls. We excluded twin pregnancy, over GDM, blood cell disorders, and cardiovascular disorders. The GDM status, hemoglobin, and other confounders, pre and post pregnancy anthropometry, that is the patient's BMI, was recorded. Mean gestational age of hemoglobin sampling was around 19 weeks. Here are the population characteristics that we found, and if you see the hemoglobin levels, we see a significant difference between the GDM and non-GDM populations. Other significant factors are age and pre-pregnancy BMI. Coming to excluding the covariates or the confounders, running a linear regression model showed us a mean difference of 0.531 grams per deciliter hemoglobin levels. Upon stratifying it by different HB quartiles, above 75th quartile, that is 12.3 gram per deciliter hemoglobin, we saw that the risk increases as odds ratio becomes 4.72. Also, looking at overall risk without stratifying it into HB quartiles, we see an odds ratio of 1.37. Stratification by BMI gain again showed that the fourth quartile with BMI gain of more than 6.27 kilogram per meter square had a greater chances of developing, had a greater correlation between hemoglobin levels and the chance of getting GDM. This shows that yes, there is an inverse correlation between hemoglobin and the risk of getting GDM. The prospective mechanisms that have been discussed in current literature are the hypoxia-inducible factor pathway, which says that presence of hypoxia represented by hemoglobin levels can improve the entire metabolic profile, not only insulin sensitivity but other factors like dyslipidemia, etc. Iron induces oxidative stress, and that is also a viable theory that is prevalent. Our case control study, of course, had its limitations, as we cannot establish a causation between hemoglobin levels and GDM incidence. And this was a single center based study, and since we have a tertiary care center, the patient population characteristics are very fixed. To conclude, HB levels are significantly associated with developing GDM. prospective studies are required further to see, further to investigate this relationship. And finally, I would like to say that maybe this would pave a way to a more tailor-made iron regimen for high-risk patients, high-risk GDM patients. Thank you.